Even if you've done isolated hip flexor lifts before, you're going to want to make sure you check out this whole video because at the end, I'm going to show you how you can use a strap like this to completely change how isolated hip flexor lifts interacts with your quadricep muscles. And you can really modify this exercise to be more effective for a lot of people by using a simple, inexpensive strap like this. It's a multi-loop strap, 2.5 meters or 8 feet long. There's more information in the description below. And you know what else? There's more information in the description below about my new book, Psychedelics, Chronic Pain, and the Posturedelic Hypothesis. My name is John Clark. I'm the only psychedelic posture therapist in the known universe. And this book is about my new facilitation protocol that I call it Posturedelic therapy or psychedelic-assisted posture therapy, where we strategically integrate psychedelic interventions to increase the effectiveness of posture therapy, get you out of pain more quickly, hopefully, by achieving breakthrough results. That's what the idea of this book is about. If you want to check that out, it comes out June 4th on Amazon, print, ebook, paperback, hardcover, all that good stuff. Now, let's get into the isolated hip flexor lifts, which is what you're really here for. Before we get on to how this strap can be incorporated into isolated hip flexor lifts, well, this is an exercise I've never covered on my channel before, so I need to show people how to do this exercise without the strap first. I'm covering this exercise because it's actually mentioned in my new book, and I didn't have a video up about it. So that's what you're benefiting from today. Let's go ahead and get the dog out of the way here. And we can lay down in the hook line position, which is the starting position for hook line isolated hip flexor lifts. And what we would do normally is we would go up onto the ball of the foot and press into the ground, press down into the ground with just the ball of my foot while lifting the heel of my foot into the air. And one of the problems with this is that a lot of my clients would actually get cramps in their calves while trying to do this exercise, and could be uncomfortable for them, or even they couldn't do the exercise because of those cramps. That's one of the things that this strap can help alleviate. But what we would do after that, I'm going to switch feet so that you can see what the other foot would do. So now, now my left foot is doing what my right foot was just doing, pressing into the ground with the ball of the foot, and this is the core motion of the exercise right here. Now, of course, if we are wanting to emphasize reestablishing a proper S-curve in the spine, you would want to get something like cervical rolls. These are from Posture Guide Mike. You can get them anywhere. And let's see. I can put them underneath my lower back. The proper placement is just underneath the belly button. And then I could start this exercise from here. Now, is you just want to bring up the leg about 3 or 4 inches. Okay, or the foot about 3 or 4 inches off the ground. Now, here are the numerous things that people would do wrong with this exercise. One, they wouldn't push into the ground hard enough with this leg. And if you don't push into the ground hard enough with this leg, well, now your hips and pelvis aren't stabilized. And so when you lift, your back is going to arch into the air because none of this is stabilized, so your back has to compensate. So that's the first problem I would see. And then your hips are doing no work. Now that is actually encouraging a maladaptive compensation rather than reversing the compensations we're going for. So that's the first mistake I would see. The second most common mistake I would see is that people would lift up this leg, but when they do, they would either let this go slack and let that knee fall in, or they would, without realizing it, start straightening the leg. A lot of the times they would try to lift the leg, but because their hip flexors were so weak, their brain was just thinking, get the foot up. And so the way their brain was getting that foot up was to extend the knee, right? So they're doing more this type of thing rather than this type of thing. And all those problems make that exercise completely ineffective, or can even make you worse. It can cause pain by encouraging compensations that are not productive in terms of what we're trying to do. What we're trying to do is reteach the hip flexor that its job is to flex the damn hips. And If the quads are getting in the way, or the hamstrings are getting in the way, or the other leg, if they don't have the proprioception to understand that they don't have the strength to push down, they don't have the proprioception to understand that they are bending their legs, all these types of things, well, this can be solved by the simple addition of a multi-loop strap like this. This strap it's got 12 loops, 8 feet long, about 2.5 meters or so. More information in the description down below. The way I'm going to apply it to my body is just like I did in my previous video about this. I'm going to find the center of the strap. I'm going to put it underneath my legs, grab the two leads of the strap, bring it down into this space between my groin and the other strap here. And then I can take one lead and fix it onto my right foot. The right lead goes to the right foot. The left lead goes to the left foot. And then I can cinch this strap up around my thighs to find an appropriate length such that when I lay down, let me show you how this should look. Now, when I lay down here, I am going to make sure I get this strap even. And if I try to push my feet away from my body, I can't do it. See how this portion of the strap right here that's going down between the legs is preventing me from straightening my legs all the way. There's too much tension in the strap for me to overcome. And this locks out, this fully engages my quadriceps in their primary task of extending the knee, of straightening the knee. If they're engaged in their primary task of straightening the knee, they can't do work like letting the leg straighten or letting the leg or the knee bend or any of those types of things because I'm forcing it to stay in a locked position. Now, this does change how the other foot has to, how the bracing foot has to react. Instead of doing the ball of the foot on the ground, I'm going to put my heels on the ground, and then I'm going to flex my foot and point it to put extra tension on the strap, such that now my hips and pelvis are stabilized by the tension that my foot is putting on the strap. And from here, I can lift one leg just a little bit, and it is impossible for my quadriceps to do any of the work of lifting up this hip. I am feeling this work intensely in my primary hip flexors. I'm going to take a little break, do the other side, and you can really feel this targeting the muscles that we're going after in the hips and pelvis. If you find that you're still having trouble stabilizing the spine, even with pushing away and tilting the foot, you can also use your glutes to push your heel down into the ground a bit. And we are still getting that same activation through the quads or through the calves, or to a certain extent, we're still getting activation through the calves because we are flexing the foot. So we are getting activation through the calves like we were in the other position. It's just a slightly altered position to account for stabilizing the head of the femur by putting tension on the straps. And that is how we would modify isolated hip flexor lifts to go with the multi-loop strap. You can find more information about where you can purchase a strap like this in the description down below. You can find more information about my book and in the description down below. And of course, I'm even putting up on my blog.chronicpainrewired.com. You can find excerpts from each chapter as new ones coming out each week in the weeks leading up to the release on June 4th on Amazon. I hope you guys check out this book. There's some really cool information in here. And that's all I've got for you right now. I'll see you next time. My name is John Clark, Posture Monster John, the only psychedelic posture therapist in the world. Hope you follow and subscribe if you want to get more content like this.